CVP, ready? CVP dressing change. So CVP dressing change, you're gonna, again, you're gonna have your dressing kit. You're gonna have new Lurlock connectors and new alcohol gel caps to replace. Okay, all right. Okay. And then the other thing is that every shift, every single one of these lines should be flushed with saline and checked for blood return every shift to make sure that they're staying patent. Okay. All right. So patient would wear a mask. We'd want to wear a mask. We'd want to have an order that says it's okay to do maintenance care of the CVP dressing while the person's in the hospital. If the patient's not able to wear a mask, we'd have them turn their head. Okay. All right, so hi, Mr. Smith. My name is Mary. I'm going to be your student nurse today, and we're going to change your dressing because it's been a little red and a little bit of fluid leaking under there, and we don't want that sitting on your skin. So we're going to take the old dressing off first, okay? And so when you guys are taking the old dressing off, and remember these mannequins are older mannequins, and so taking a dressing off a mannequin and the dressing off of a real human is a little bit different. And if you cannot get them off of your patient, one thing that works really, really well is if you use an alcohol pad and you just rub on the edges, and that helps you lift that dressing off a little bit better. Maybe. How long has this one been on here, huh? And so, of course, when you're trying to get these off patients, it's going to hurt them. And so being careful not to tear their skin too, because that would be considered an unusual occurrence, and then put them more at risk for infection too because of now having a wound. Also, when you pull these tegaderms, I don't know if anybody ever told you, but if you pull this way, see how it just lifted off? When you pull the opposite way, it just kind of pulls off itself. This one's been on here since last semester, maybe, huh? See how that just kind of lifts right off? Kind of a nifty little trick. Just have to be careful not to pull your dress or your line out now. And so holding. You don't want to touch that, of course, so hold your line the best as possible. Without touching where it's actually inserted. And when you're first doing this, guys, it's kind of a interesting challenge trying to get it off. And so this is probably going to be the longest thing to do, is getting that dressing off. And it's probably going to scare you when you're trying to do it because you don't want to hurt your patient. And then this little support thing just helps keep that supported. Okay, we don't want to touch that site. Okay, so then change your gloves and make sure that patient keeps his mask on, keeps his hands from touching it and different things. And we don't want to cough or breathe on it ourselves. Okay, all right, so we're going to get our kit ready. All right, so our patient would wear a mask, we would wear a mask. And then you don't want to have your hands lower than your waist, of course. And of course, this might be a little too close to your patient, but just today for this video, if we had more space on our table.
All right, so let's document this and then we'll let you practice or let's go to lunch and come back and practice or whatever. All right, so let's document this. IV lock removal. Anybody want to give it a try? Okay, how patient procedure, but let's tell a little story. So IV lock to the forearm. And we want to tell how it is, right? We want to say how it is.
So who would we call in that case?
Yeah, no redness.
And not a Ghostbuster either.
Something
Right.
like that, right?
So someone would have to bring you new gloves, right?
And then
So you turn on your call light or have your patient turn on the call light. Okay, so then we're gonna get rid of that.
pressure Band-Aid applied, or whatever the hospital policy is, right? Whatever
So
it is.
this we're gonna put by our
And
patient.
then I let you guys all
This
see
we're
it.
gonna
It's intact.
snap and have it ready to go. This dressing we have ready to go. This is our
They ever pulled this and
cleaner,
you need to
our other alcohol swabs. So there either be a Clorox
right?
prep or one of these. And this is good because it helps with more stickiness. Does that make sense? And so we're gonna, actually I wanna use this one first. Okay, so we're gonna
All right, makes sense?
clean around the edges. And when you guys do this, you're gonna wanna be careful because you're gonna be scared to move that too much. Okay, so then we have to get rid of that.
Sub-Q, right? NG sub-Q.
Oh, so we would have to have another sponge or this gauze even to help dry it a little bit. Okay, and then there's not in here, but it should have one of those little circled sponges that would go around there to protect that site. Some kits have those now, some don't. Most kits do these days at the hospitals. Okay, so those little circled sponges have a little slit in it and it would go up along the side there. Okay, if you don't have one, it's okay. The biggest thing is we want this Tegaderm where you can actually see that insertion site through it. Okay, so we're going to take this like this. And we'd want to make sure that these clamps are not going to be under the dressing. Does that make sense?
Thanks, guys. Thank you for the attention. Nice job.
And then once your site is covered up, you're not as sterile anymore. Okay, and then if you wanted to put another piece of tape along here, you could. As long as it's secured down, it's all good to go. Don't put your clamps under your dressing. Usually the CVPs don't usually sit that high. They're a little bit lower, so it's not so high up on the neck. So you got a little bit more room, and then you'd want to time date this, and then time and date and initial it of who changed the dressing last, and make sure that that's off to the side instead of right over the insertion site. So what kinds of things you would chart about all of this is what that CVP line site looked like when you took off the old dressing. Was there any drainage on it? Was the site red, swollen, draining at all? If it was, you would be on the phone with that healthcare provider that inserted it and saying, do you really want me to cover this, or do you want to culture, or do you want to come by and see if this line needs taken out because this person may have a possible infection which could lead to sepsis. And so anytime you see any redness, swelling, drainage, patient complaining of bad pain, always alert that healthcare provider that put it in to assess it for infection or a problem. Also, these clamps should always be closed. when you change your dressing also, you're going to be putting new caps on each end of these. And if you hadn't flushed it for your shift yet, when you change the dressing, that is a great opportunity to flush each of those lines as you're doing that dressing change. Okay, every single line should be assessed for good blood return every shift. You might hear in a report this person's had the CVP line in for weeks. And so the red port doesn't give you any blood anymore, or the blue one or the white one. And so making sure that you report that onto your next shift of coming in is important. And also really someone really shouldn't have a CVP line in for months at a time anyway. It's primarily just for acute care reasons until they can get a PIC line or a port. Okay? Oh, and how patient tolerated that they wore a mask and if they had any pain when you're changing the dressing. Okay?